But without further ado, I would like to introduce you Dr. Zina, my co-lead of this fantastic program, and she is going to lead into the discussion.
Yes, I can.
And so
I
if
have
the
my
speakers can come
up
up.
here.
Don't say too close to the microphone.
Oh, okay. So as the speakers get set up, I know we have one question from the streaming still. Is that correct? We have two questions, so we're going to start with one of the streaming questions. And then I'll get another microphone out so I'm not running across the room.
I think we should go black, white, stripe, and black. Oh, yeah. I'm kidding. I'm kidding.
We thought you were serious.
I want to ignore everybody on this side. God, that's like in these lights.
The lights are so bright.
And those. What?
You ready?
So the first question from our international streaming audience was for Dr. McClay. It's actually a two-part question. The first was, what's your opinion about using Hill's Derm Defense food for mast cell tumor treatment for dogs? Maybe you know some studies on that. And then the second question was about if there's a Derm Defense option for cats.
So the first question again was, have we looked at using Derm Defense and any mast cell tumors in dogs? We have not looked at that. If you have any personal experience, we'd certainly be open to hearing from you on that. But right now we haven't done any studies. The second question was Derm Defense options for cats. Not in the works necessarily right now, but again, we're always interested in feedback from the field as to the need for such a product.
Do we have any evidence to show that we can induce food intolerance? A new wave is people thinking that they have to keep changing proteins as they feed their pet. I mean, I'm just trying to get a sense of, what to tell them. I always stay with the same protein because if they do develop, I'm not going to have a novel protein, but I'm getting all these things, or people coming in, who's ever telling them that it's better just to keep rotating.
Yeah. So the question, I'll answer that, I guess.
Yeah.
So the question was, all of us are getting a lot of owners that are rotating protein sources, and is there any evidence that that is helpful and helps avoid development of allergies and intolerances? And that is a very, very common scenario these days. A lot of owners seem to have the belief that if they rotate protein sources and don't feed any particular protein for a long period of time, somehow their pet won't be allergic or develop an allergy. To my knowledge, there's no evidence to show that makes any difference at all. And I usually, when I talk to owners about that, I agree with what you said, that for us, it's actually a problem, because if they're feeding all different protein sources, then if the pet actually develops an adverse food reaction, it's very hard for us to find a novel protein source. And I usually bring it back to humans and say, you don't avoid eating chicken because you worry that if you eat too much chicken, you're going to get an allergy to it. And similarly, we don't have any evidence that that makes a difference in pets. Great question.
Since Derm Defense is chicken-based, and that's a common allergy for pets that have food sensitivities, is there any thought that you guys might develop an alternative protein source, but in the Derm Defense line?
So right now, the question concerns chicken as the base for Derm Defense. And we did that because it's really designed for pets with environmental allergies, environmental sensitivities. We need to learn more about the crossover between pets that have potentially chicken allergies, because it's not the largest percent of pets with food-related allergies, and so we need to find out really what the overlap there is. There is an option, which is what Dana presented, that idea of trying a DD type product. So we need to find out what the opportunity and the need is there for such a product.
Are there any others from the streaming? No, we've got a hand here.
I was just wondering, a lot of the clients that I have, they're coming in, they're basically worrying more about being holistic, organic, certain colors of food that I'm not going to mention. What is the best advice I can give to them? Because I look at more of how the food's balanced. Byproducts doesn't necessarily mean a bad thing. So what advice can I give to my clients to try to make them understand that?
Is that a question for me? I'm assuming.
I'd
be happy to answer it.
I think you answer it every day, so that would probably
I do,
be a good-
unfortunately. So that's a fantastic question. How do we deal with clients that are really confused about what makes up a high quality food? They're concerned about finding a holistic food or similar. So usually it's important for owners to understand what definitions actually have meaning in the pet food industry. So something like holistic, usually I'll ask owners, well, tell me what it is you're looking for in a holistic food so that I can understand what they're looking for, since holistic actually doesn't have a definition in pet food labels. As far as, usually the owners will just say, I just know I want a high quality food. And I usually bring it back to those WSAVA guidelines, the World Small Animal Veterinary Association guidelines that came out, their nutritional assessment guidelines that very black and white and objectively give you criteria for evaluating a pet food. And I tell them, because owners always worry that we have a conflict of interest as veterinarians selling pet foods. And I say, this isn't my criteria. These are criteria that were determined by experts in the field from all over the world. And these are the criteria I use when I come up with options for you. And they help us pick high quality foods for you. And I make it very black and white and objective. And I think that owners are often more open to that versus when they feel like we're subjectively saying that we recommend something. So it's a difficult discussion, but I think that owners are often open to that. And I love to refer them to the website because there are some really great tools on there, like the internet, nutrition on the internet for dogs and nutrition on the internet for cats. A lot of that is very eye-opening information for owners and answers a lot of those questions.
If I may add to that,
Yeah.
I work in marketing at this point in time, and so I get this opportunity to see what owners, claim to be wanting. And I came to a personal conclusion, that sometimes it's extremely hard to change their perception, because for them the perception is the reality. If they are gluten concerned, they will project it on their pets because pets is part of the family. So even though, we know gluten has no really concern for the pets, sometimes it's important that you find a solution that is a good diet or the good product and also doesn't have gluten and also doesn't have soy protein and also doesn't have lactose, because it helps to comfort them. So I think, hopefully the manufacturers of the great foods will continue to bring you options that are considered more natural by the consumers, because you can try and fight them, but ultimately, at least the research we see tells us that they could just gonna go ahead and buy something really bad in a grocery store. So I think you need to take that into consideration as well.
Absolutely.
Well, I actually was going to address that issue, because our concern is that we ourselves are trying to eat whole foods, and the closer to being a whole ingredient is what we look for in our food, and certainly our clients expect the same thing for their pets. So we have a real challenge trying to convince them to purchase foods that are maybe more expensive or not, but more importantly, it's not the prices, that when they look at that label, there's nothing they recognize as being whole food.
Yeah.
And you guys have a real challenge, and we do too, convincing them that they're not better off getting spot stew or some other, or even home preparing their foods using, Balance It or some other alternative, because we're fighting this battle, and we're not going to win unless they have a specific medical condition that we know we can fix with that food.
Yeah. No, it's a huge challenge. And sometimes with those owners, going through the ingredient lists and letting them point out some of the things they're worried about. And sometimes they're simply synthetic vitamins and minerals that maybe they just didn't recognize the name of, and that makes them feel a lot better. Oh, that's just vitamin C. Well, I take vitamin C and I feel better about that. But definitely there are absolutely clients that really are looking for other options, and it's a growing proportion.
So my question kind of directs back to the last one. When clients come in and they've researched foods online,
and they come in and say, oh, this one got 5 stars on such and such websites, and I say that there's no veterinarian, no nutritionist that are focusing on those, are there ones to send them through that nutritionists actually write and give stars recommendations to?
So those would be the clients I would go through the WASAVA nutritional assessment guidelines with, because those are criteria that the online raters should be using as accepted by the profession. And usually I point out with like the leading rater of dog food that, they're not veterinarians. They really love their pets and their intentions are probably really great. But based on what experts use to evaluate the quality of pet food, this is what I look at when I'm trying to help you find a food best for your pet. And, some owners, you have to compromise, but I think a lot of owners appreciate that we're using some guidelines that the profession has established, and they don't realize they're available to us. So I find it very helpful.
So I have a question. I'm over here. I'm really short. Thank you.
We're we couldn't find you.
Yeah, we're kind of blinded.
Is the same as sitting for some. So I am kind of in a unique position. I'm a clinical instructor at the University of Missouri in community practice. And I was in private practice for years, came back to academia. And what I found is that the students seek out my opinion specifically for contract negotiation. And so what I'm finding is that the generational issues are smacked in their face when it comes to that. And so I am also one of the 20% that's a cluster between Gen X and millennials, and so they also kind of find me in neutral ground. So I guess I'm just looking for some sort of resources that I can pass along to them to try to navigate the contract process, because I'm finding between the baby boomers, who are the potential employers, and the millennials, which are the employees, that there's a very large barrier. And so I just wanted to be able to pass some information along to them.
So there are a couple things that I outlined, I think, in the proceedings, a couple of links and book resources that I find very valuable that talk about the generation in the workplace, but also bring a very important statistics, right, about what are the things that the employers have to consider when they hire millennials. And because some people say, oh, they're all about passion, so let's not pay them enough money. Hey, this is a basic thing. You need to pay money. Passion comes on top of that.
Millennials have student loans.
Millennials have student loans. They have to pay all those bills. I mean, you cannot go by, hey, you have, you're a millennial, you're young, I'm going to pay you a little less than. So there are a couple of resources out there. There are a couple of companies that are specifically focused on researching millennials and have access to the millennial communities where they can bounce back different questions. So one of them is White Pools. We partnered with them for company purposes many times, and they came and made lots of interesting lectures for us as well. So numerous amount of companies that are focused on millennials and helping them out to counsel them and help them to enter the workforce in a right manner. Because many companies are challenged, including ours. It's hard to hire millennials. They don't go to every, it's hard to engage them and show them, hey, this is a great company to work. And so.
And what was the name of that company again?
White Pools. So today they're out from New York, I believe, but every region, everywhere in the world, millennials are a buzzword, at least for now, until the next generation comes in. And then everybody says, oh, millennials, who cares about those? Think about Gen Z and digital natives. So, but multiple companies. And if you want, I can stay longer and guide you a little more on that. And if you have a specific question where I can help you answer.
Add the mic.
I just wanted to hear your opinion on home-cooked food trials.
Sure. So the question was, she was interested in my opinion on home-cooked feeding trials. Those are certainly a great option if they're formulated by a board-certified nutritionist. Any recipe that an owner finds online or even in a textbook is the overwhelming majority of those foods are unbalanced. Those recipes are unbalanced, so it's not a reasonable option for these clients. So if they want to go that route, they need to be willing to take the time, set up an appointment with a board-certified nutritionist. A lot of people then say to me, well, I don't have one near me. A lot of them will do phone consults, so it is an option. But the concern with why owners want to feed homemade, one thing I find is that owners, if they say they want to do homemade, usually it's that they think it might be less expensive. It is not. They think that it's going to be easier. It is not easier than ordering a therapeutic food. And it's a lot of work. I'm always happy to do that, but it's very important that owners know before you refer them to a nutritionist, before they consider a homemade food, it is a lot of work. When we formulate recipes for clients, we have them using gram scales, measuring ingredients. This is not a free-for-all where they're going to get to rotate and use chicken today and use salmon tomorrow. So oftentimes owners have misconceptions about what a homemade diet's going to give them. And so as long as they have all the information and are still interested, it's a very reasonable option for an elimination diet trial. But it's very important that it's done extremely carefully, using a gram scale, using exactly the ingredients and amounts that the veterinary nutritionist recommends. And so it is a lot of work. And so it certainly is not for every client, because if it's not done correctly, it will be unbalanced, and then the pet won't be getting the nutrition we want them to. We have another question over there.
In that same vein, how are you guys dealing with like these raw food enthusiasts and like actually trying to convince them to not do it? Because I feel like once they get their mindset on it, they absolutely cannot be swayed. And there have been some cases where, particularly with skin, once they start feeding it, it actually does get better. So it's kind of like a sticky situation. Like, how do you deal with that?
So oftentimes when they do see improvements, if the dog has, so the question was, how do we deal with raw food feeders, people that really are passionate about feeding raw, and especially those owners that feel like they saw an improvement when their dog went to a raw food. In the cases of skin disease, when the owner sees an improvement in the dog, when they go to a raw food, it's typically purely based on the fat content, because a lot of the raw food diets are high in protein and high in fat. And so usually it's purely that. And so it doesn't mean that the pet is getting all the nutrients they need. It just means that there happens to be quite a bit of fat that's maybe making their coat look a little bit better, but isn't indicative of the pet's overall health. Usually when I discuss raw foods with owners, I'll try to encourage them to at least cook that food. Usually I'll talk about the risk not just to their pet for infectious disease, but to their entire family, because people can get sick from this. And if they have someone in their family with cancer, a child in the house, it's very, very dangerous, because they can get sick from these foods. And there's a lot of evidence to support that the foods are often contaminated. And even, just as importantly, we have a number of studies that have been done recently that show that many of these raw foods actually don't even meet the nutrient requirements of a dog. And so that sometimes is enough for an owner to be willing to switch to another food, because usually they're doing it because they think they're doing what's best for their pet. That's what they want. So if they find out most of these foods are actually not even meeting their dog or cat's vitamin and mineral requirements, sometimes that's enough to convince an owner. But it's a difficult conversation for all of us. I know that everyone in this room has probably struggled with that. Great question.
All right, any further questions for our panel? I see hands. Okay.
You had mentioned that lovely saliva test for food allergies earlier, and I'm curious how you politely handled that with your client. We have a holistic practice in our area that's doing a lot of those.
Yeah.
And from what I understand, there's no validation whatsoever on those tests.
Yeah.
So I'm curious your opinion.
Yeah, so the question was, how did I handle the saliva test that Stella's owner had already purchased and brought with her? And that's a really great question, because those are difficult situations, because certainly the client has already spent their money on this and obviously thought that there was some value in it. So we want to be careful. We don't want to get any owner on the defensive, because they're not going to be open to our recommendations if we get them on the defensive. So usually I try to just guide the conversation elsewhere. I say that's really interesting, and I'll take the time to look at it, because I think we've all learned that an owner wants you to look at what they bring you, even if it may not be something you're gathering information from. So in Stella's case, I looked at it and I said, that's really interesting, and I pointed out a few foods that Stella had actually not ever had before, and I said, usually if the food is something that they're allergic to, they would need to have eaten it before. So I worry a little bit. Usually I'll just say I worry a little bit about that, and then I'll say, but we do have a really great way of diagnosing adverse food reactions, and I steer the conversation towards the positive, that I have great news. I have the answer. We can get to the bottom of this. We just need to do this trial and kind of avoid the discussion that could go in a negative manner. Because we certainly don't want to offend these owners, so it's a very good question.
All right, we have time probably for one more. Anyone? No others from the panel? Okay. All right.
It's so hot up here.
All right, it's nice and warm up here in between these lovely ladies. So as a matter of fact, we have a little surprise for you, of course, before we're leaving. And that will be coming in right now. And Bianca is coordinating that.
Ta-da.
Excellent, she is. As always. I think they were coming in. But I just wanted to thank all our fantastic speakers for their wonderful, wonderful lectures.
Thank you. You're welcome.